say thank you. I also want to thank our healthcare workers, the nurses, the doctors, public health staff, and other medical professionals who are working literally around the clock to take care of the sick and protect the healthy. Today, we want to provide you with updates on several fronts. First, Virginia State epidemiologist Dr. Lillian Peek will give you the latest numbers on Virginians who have tested positive for COVID-19. I believe that's going to be Dr. Norm Oliver. So, Dr. Oliver, thank you.
As the governor mentioned, the public health workforce is very hard at work on contact investigations and that sort of thing, and Dr. Lillian Peek is unavailable for the news briefing this morning because of that ongoing work. I will give you the update on the numbers that we have for this morning. Yesterday we reported 67 cases. There were new cases overnight, and we currently stand at 77 cases in Virginia. Those cases break down by the region as 14 in the central region, 19 in the eastern region, 39 in the northern region, 5 in northwest, and we still have 0 cases in southwest. We also would like to report that we have 3 outbreaks of coronavirus illness, the COVID-19 illness. And when we say outbreaks, what we mean by that is 2 or more cases that we can trace to a common exposure. As you know, one of those outbreaks is in the Peninsula Health District, and specifically in James City County, where we have 17 cases and over 315 contacts of those cases that we are investigating. We also have 2 other outbreaks in Richmond, and for more specifics on that, I refer you to the Richmond City Health District. I should also report that we have currently 65 tests that are in the process of being run at the state lab. There are probably tests as well being run by LabCorp and Quest, the private labs. So there will be other cases that will develop or be confirmed during the day. We have the testing capacity at the state labs to test 260 to 360 patients. We're anticipating new reagents from CDC, which will allow us to increase the number of tests that we can perform, and we expect to receive those reagents within the next day or so. And with that, I'll hand it back over to the governor.
Thank you, Dr. Oliver. I know that everyone is concerned about our hospital resources. I was an Army doctor, and I know what it's like to be in a crisis situation with finite resources. I want to assure Virginians that we are working closely with our hospitals to help make sure they get the resources that they need to be able to take care of those Virginians that require them and that are sick. I'll ask our Secretary of Health, Dan Carey, to provide more information regarding our resources. Dr. Carey.
Good morning, and thank you, Governor. Virginia's hospitals and health systems have nearly 2,000 ICU beds across the Commonwealth. Those beds have access to ventilator and respiratory support equipment in the event that an individual patient requires that level of medical care and intervention. In addition, the respiratory support equipment associated with those beds, the 6 regional healthcare coalitions that function under the Virginia Healthcare Emergency Management Program, VHEMT, has approximately 400 ventilator units that can be deployed to specific hospitals as necessary. Beyond that capacity, the strategic national stockpiles have stores of medical equipment, including ventilators, that can be called upon to address emergent public health situations. And as needed, healthcare providers work
with schools to make available capacity for child care centers to provide the necessary care to essential personnel. I'll be happy to answer questions later on. Thank you very much.
And finally, we are hearing from the American Red Cross that they are experiencing a shortage of donated blood as blood drives are canceled. We are all focused on the coronavirus epidemic, but car accidents or childbirth or emergency surgeries don't stop. Our need for blood does not stop. So I'm going to donate blood this afternoon, and I urge all healthy Virginians to do the same. There is no evidence that coronavirus can be transmitted through blood, and the Red Cross has implemented additional procedures, such as testing donors' temperatures to ensure safety. James Hatcher, CEO of the Virginia region of the American Red Cross, will tell you more about that. Mr. Hatcher, thank you.
Thank you, Governor, and good morning. I would just like to reemphasize what Governor Northam just said about the impact on the nation's blood supply. In the last 2 weeks, we have seen thousands of blood drives canceled, and the impact of that has been hundreds of thousands, or approximately 100,000 units of blood not collected just in the last 2 to 3 weeks. We project that trend to continue. As the governor noted, there are some things that you can reschedule when it comes to the need for blood, but there are many that you cannot. In this time of uncertainty and people wondering, what can I do to help? Certainly, we've talked a lot about that, social distancing, staying at home, but another thing you can do to help is, if you are healthy, feeling well, is to roll up your sleeve and give blood. It is a critical need in our communities, both locally within the state and across the nation, and it is something that each of us can consider doing that has a dramatic impact, dramatic positive impact during this time. So thank you very much.
Just if you could let folks know how they could do this, should they make a phone call?
Oh, absolutely. So the question was, how can you, if you are able to give blood and want to do that, how can you do that? In order to support the social distancing and gathering guidelines, we ask that you go onto redcrossblood.org and make an appointment at one of our fixed sites. Most of our mobile drives and drives out in the community are the ones that have been canceled. Our steps at our fixed sites, there's one at Emerywood Parkway, there's one on the Arboretum, there's one in Short Pump here locally. You, again, can go under redcrossblood.org, make an appointment. That ensures that when you get there, you can be tested. We can ask you some screening questions, and that we can pace people through the blood drive process to ensure that we are, again, respecting the gathering limits that we have in place to ensure safety.
Thanks so much.
Thank you very much.
Some final updates from our administration. Yesterday, our Board of Elections announced that it is encouraging voters in our upcoming May elections for local offices to vote absentee to protect their health. For this election, voters who want to vote absentee will still need to list a reason. They can mark the box 2A, I'll repeat that, 2A, for illness or disability. The deadline to request an absentee ballot for our May elections is April the 28th, April the 28th. So voters should request those ballots as soon as possible. During this time of uncertainty, it is important that our democratic elections process is not impacted. Absentee voting will ensure that all voters in towns across Virginia are able to exercise their right to choose their local officials. Second, our Department of Education announced yesterday it is working with the federal government to ensure maximum flexibility for testing requirements for students. Last week, I ordered all K through 12 schools to close for at least 2 weeks. Some school divisions have announced plans to remain closed for longer. We want to make sure that testing requirements don't impact schools' accreditation. But more immediately, we want to ensure that this situation doesn't affect our high school seniors and their ability to get a diploma. Third, today, Virginia is submitting our applications to the Federal Small Business Administration so that every small business in Virginia can be eligible for loans to help them through this difficult time. These loans can be up to $2 million and our low interest. I know, as I said earlier, that this is a very stressful and concerning time for every Virginian. It is likely to remain so for some time. Please continue to practice preventative health measures, such as washing your hands, and please maintain social distancing and avoid large gatherings. We will get through this, but we must work together and take care of each other. So thank you for complying with our guidelines. I'll be glad to take questions. It's a great question, and we do. The question was, have we thought about deploying the National Guard? And that's certainly an option that is on the table. We have not made that decision, but we have been in contact with the leadership of our National Guard to make sure that they're ready in the need that we do call them. They have been used for various things at various times in our history, during disasters, during crises, such as helping to deliver food. In this particular situation, I can foresee maybe the possibility of helping us if we need more capacity at our hospitals, whether that be with space, if we need to move into other structures, if we need to put up tents as we would in MASH units, if we need more equipment such as ventilators, and probably most importantly, if we need more staff. So there are a lot of different reasons that we would consider to call them up, but as of today, I haven't made that decision.
Some of the first line of folks who are getting hit by this on the employment side are service industry people, especially here in Richmond. What advice do you give to those who work in the service industry, and how should folks be handling it? I know there's been talk about still ordering takeout, stuff like that. Can you talk some about how that's going?
Yes, as you know, yesterday we implemented the 10 or less rule, and so, for example, the majority of restaurants are doing takeout and home delivery. For individuals that are just literally unable to work because their businesses don't allow that anymore or have closed temporarily, I would encourage them to talk to our Employment Commission and make arrangements for unemployment, and those things are all in the process or in the works to do for those individuals.
Related to that, we've gotten a lot of complaints about workers feeling their bosses have not been implementing safe standards based off the guidelines, including some from food processing plants. What is your recommendation to do? What can they do if they feel this is the case?
Yeah, it's a great question, and I think it gets back to and it's a difficult definition, I will admit, of what's essential and what's not. But for example, your question about food processing and food manufacturing, that needs to continue. We need to have nutrition for Virginians. And so, we have been in touch with those employers and encouraged them to use the same safe practices that we've talked about. And I mean, you could compare it to healthcare providers. I mean, we need our healthcare providers. We need people that produce food. So that will continue, but as best they can to keep the social distancing, to use good hygiene, hand cleaning, sanitizing equipment, all of those things, and that's the way we'll move forward with that.
Is the state considering its own economic stimulus measures? I'm thinking things like mandatory paid leave at the state level or payouts to businesses and workers affected by this using state dollars specifically.
It's a good question, and the question is the state considering economic plans such as paid sick leave? As people may recall, we actually introduced a bill this past session for paid sick leave across Virginia. It was defeated. I regret that, and it's something that we'll bring up again during the next session. As far as stimulus packages, as far as what we're doing with our economy, what we're doing with our budget, it's a day-to-day process. This is a dynamic, changing situation. Secretary Lane, who is our Secretary of Finance, and we talk frequently each day. We will be making adjustments as needed, depending on what the economy is doing with our budget. As you know, we have reconvened session in April, and while we haven't made any changes to date, that's an ongoing process.
And clarification,
Yes.
when you say next session, is that the next session next year, or will it be addressed in the session in April or perhaps a special session?
No, this session, the reconvene session, will be to address bills that have come to my desk in our budget. Yes. Hi.
The ACLU is calling for pretrial jail inmates to be released, as well as vulnerable kinds of populations, like people who are very elderly or terminally ill. Is that something that your administration is considering right now?
Secretary Moran, if you might want to answer that. Thank you.
Thank you, Governor. Brian Moran, Secretary of Public Safety and Homeland Security. And Mel, we are looking at all available means by which to ensure the safety of our citizens, including those residents of our local jails and prison facilities. The Department of Corrections has taken some extraordinary steps to not only secure the health of their inmates, but also of the personnel at DOC. We have suspended visitations. Lawyers now have non-contact visits, and we have suspended transfers of inmates from local jails. We are working with our sheriff community to take the necessary steps to continue to ensure the safety of all involved.
Governor, maybe a question for you and Dr. Oliver. Talk about the 3 outbreaks, one being in Maine City County. You touched on it yesterday. Could you elaborate again? What would you want those individuals 65 and older to do? I mean, they are still working. You don't know. Could you elaborate what you want those individuals 65 and older to do? And also, could you clarify, is it 17 cases in the Peninsula Health District or 17 in Big City County?
It's 17 in James City County, and that's the particular outbreak that we're referring to in the Peninsula District. And Governor, did you want to address the 65 and older?
If you can address that, that'd be fine.
I think the guidance is pretty clear. Folks who are 65 and older, unless they're doing work that is absolutely essential, they should be staying at home and distancing themselves from any kind of interaction. They're at higher risk of becoming gravely ill from COVID-19, and that's their best defense from getting that infection.
And just to follow up, thank you, Dr. Oliver. There's been some terms that have been used, self-quarantine versus self-isolate. And I would still encourage all Virginians, including those that are over 65, that this doesn't mean that they have to stay in a room in their house. I mean, on a pretty day, for example, we would encourage them to get out and take a walk, but again, to remember keeping their distance from other individuals. That's the main thing, to keep them safe.
Governor, Sentara just announced they're temporarily suspending their drive-through testing sites because they're low on those testing supplies. So can you elaborate a little bit more on when you expect more supplies to come and whether we have tapped into the national emergency stockpile, and if so, why not? If not, why not?
Yes, I may have our director of our lab, but I would just remind folks, and I think that every day our ability to test our supplies are better and will continue to get better, but there's still a screening mechanism. Questions will be asked. Has someone had contacts? Have they had travel to endemic areas? Do they have the symptoms of the fever, the cough, the shortness of breath? And if they meet the criteria, then they will be tested. So until further notice, we'll still go through that screening process and then the testing as a second step. You might want to elaborate on the testing. Thank you.
Good morning. I'm Dr. Denise Toney. I'm the Director of the Department of General Services Division of Consolidated Lab Services. So you are correct. There is a nationwide shortage on a wide range of different supplies for the collection of samples for testing, and in addition on the supplies that we're using to actually perform the test reagents. Right now, the recommendation and the approaches that we are using is that we are attempting to procure as many of those supplies as we can. We can get many of them from the federal government, and those are being purchased and being supplied at the state level. And for our laboratory here, the state laboratory, when we get those supplies, we are working in collaboration with the Virginia Department of Health to get those supplies out to the localities where they are needed most. So that is our first priority. And then for testing supplies, there are a variety of components and different ways that we can approach doing the testing, and we are pursuing every possible avenue of maintaining our ability to provide testing support for the Commonwealth, again, for the highest risk patients, which needs to be our focus right now for testing.
Just to piggyback off that question, there's been some confusion from people about where to go if they get sick, and then there's been some confusion, I think, from clinics on referring people to VBH, referring them to health departments, referring them back to the clinics. There's just sort of a circle there. What does the state doing to streamline that process? And where should people go if they feel like they're getting sick?
You want to try?
We're asking people, if you feel that you have become ill and there's a possibility that you have COVID-19, to go to your primary care provider to get tested. They can take the sample and send that sample in either to a private lab or to the state lab if the patient meets those criteria that the governor had mentioned. The confusion, I think, sometimes is based on whether or not that primary care provider is actually in the position to take the test swab. If they are not, that's when someone should call the local health department, and we can arrange for a different venue in which that person can be tested.
I was going to Governor Northam, you mentioned the issues of school flexibility for SOL, some extending their closures. Are you intending to extend that 2-week closure for the K-12s?
I haven't made that. The question was, do we anticipate extending the 2-week closure of schools? And again, this is such a fluid situation. We're assessing that on a day-to-day basis, but I haven't made any changes in our initial policy.
Thank you so much.
Hey, just one before we wrap this up. Again, thank you all for being here, number one. It is just so important to be able to get accurate and up-to-date information to our fellow Virginians. So we will be here every day at 11 o'clock, should you choose to join us. But until tomorrow at 11, thank you all, and continue the great work and continue the diligence across Virginia to really deal with this pandemic. Thank you all so much.
If you all have additional questions for any of the professionals, we ask that you stay where you are and they can come up to the podium so that we're not gathering. So I'll come over there and make sure you have her information. The idea with